A very interesting story which will help us remember the signs and symptoms of DKA in pregnancy. Now, this is a story of a girl who is in trouble and she has a very hyperactive mother. So, the story of this girl and her mother will help us remember the signs and symptoms of DKA in pregnancy. Now, if we can see the girl, she is the pregnant lady who has the signs and symptoms of DKA. So we know wherever we talk about DKA, vomiting is somehow always there. Okay, so she is having nausea and she is having vomiting. We know DKA also leads to abdominal pain. There is affection of the gastrointestinal system. So we can see from her face and her picture that she has got abdominal pain and she is vomiting. Now, if we very closely look at her dress, all the muscles that we can see, they are in cramp. So, of course, if anybody has vomiting, they will have muscle cramping and electrolyte disturbances. So, the picture in itself is saying that this lady who has got vomiting and she is in abdominal pain and she also has muscle weakness and lethargy. Now she's got so much vomiting and so many problems, so she is drinking a lot of water. That is, the bottle depicts polydipsia, and because she is having a lot of water, again she is frequently going to the washroom, so polyuria. Now, if we can see after all of this, she's not able to see properly, and of course, her condition is not good, so she is having blurring of vision. That is why she's wearing these specs, because she thinks maybe that she'll see better, but actually she's got blurring of vision. Now, condition of the mother of this lady is not good, so obviously the baby inside is not happy, unhappy, and the unhappiness of the baby is depicted as abnormal fetal heart rate tracing. So that is again a finding which we will get in these kind of patients. Now we come down to her mother who is cohabiting with her. So her cohabitant, her mother, which is also known as ma, that will help us remember ma. Now this lady, when she is seeing the girl in trouble, she doesn't know how to help with the tension. She is not good with relieving the tension. So she is hypotension. See, the tension which she could have helped with, she is not able to help with the tension. So there is hypotension. Okay, hypotension. But she is a very tacky lady. So there is tachycardia and also tachypnea. See, look at her hands, very tacky, very tacky lady, and she is also causing a hypo effect on the tension. Now, if we look at her face, she is so hyper. Look at her mouth. She's so hyperventilated. She's doing like this. So there is hyperventilation. Just look at the mother. You will get an answer to all these hyper things, And also in general, whenever in cases we have tachycardia and tachypnea, which is very evident from this tacky lady, anyhow it is associated with mostly hypotension. So because we all know there is some sort of dehydration, so there is volume issues, so there will be hypotension and tachycardia and tachypnea. And this lady, look at her, she is hyperventilating, which is very characteristic for this problem, that is the Kussmaul's breathing. And if we look at her face, she's already in shock. She's looking so shocked. Instead of helping, she is shocked, and because of this reaction by the mother, the lady's mental health is affected. Okay, so now she is mentally upset, and there is change in her mental status. So there is change in her mental status. She has become drowsy and of altered sensorium. So the story of this girl who was vomiting and had cramps in the muscles and lethargy and abdominal pain, as is evident from the way she's holding on to her tummy, and she was having lots of water and definitely going to the washroom again and again. And because of this condition, the baby inside the tummy gets very upset, and she has a cohabiting mom, that is the co-ma, by her side, who is in shock and who is very hyperventilated and doing ha ha ha. She's all surprised and in shock to see her daughter in this condition, and she's a very tacky lady, that is tachycardia and tachypnea, and there is this tension issues in this whole situation, and we all know it is hypotension because it's a volume associated condition, and tachycardia and tachypnea are associated with hypotension in such cases. So remembering this daughter and her mother and their story is very easy, is an easy way to remember the signs and symptoms of DKA in pregnancy. And this guideline is from the TOG article, the link of which will be mentioned in the description box. Thank you.